Okay, good evening, everyone. Welcome to the Health, Senior Women Services, Youth Education and Human Rights Committee meeting. My name is May. I am the chair. We are going to start the meeting. But the first thing we will do is to have a roll call and approval of the minutes. Right?
Got it. Maybe,
Here,
Larry Penn, absent, Eric Diaz, absent, Felicia Fields,
President,
Manny Fafana, absent, Anna Card absent, Robin Oliveira is absent, Ramya Rao absent, Indrani Rivera.
Here.
Scott absent, Carmen Perez absent.
okay, so the first item that we will talk about is, we will have a presentation from the Independent Budget Office. We have, it is about the federal changes on how they impact low-income households. And then you'll also talk about the Be Heard program. Okay, we have two speakers here in the room with us. We have a slideshow on the screen. The slideshow is also on the website. There might be a few details that are not on this website, but it will be on the screen and it will be explained. So please go ahead, introduce yourself, and then start your presentation. Also, after, we'll take all questions and answers after your presentation. I will call on you, and if you're in the room, you raise your hand, I will call on you, you can ask your question or give your comment. If you're in the Zoom, you should raise your Zoom hand, and we will also call on you, and you can give your comment, question, and our presenters will be able to answer.
You all hear me? Hi, I'm Hannah. I'm here with my colleague Cass. I have been at IBO for around 2 years. I'm a community engagement specialist, and previous to that, I was a middle school teacher in the city. But we'll be going over 2 reports today. The first one's going to look at how federal changes will really trickle down and affect especially lower income families in New York City, as well as around the rest of the country. And then Cass will talk about her research looking at Be Heard, explain what the program it is, and just talk about how the city has expanded and staffed it in the past. So you can introduce yourself, please.
Sure. Hi, I'm Cass. I am a lead resident policy analyst at IBO. My portfolio is everything healthcare, so I look at the health department, the public hospital system, food policy, anything public health really is in my wheelhouse. And I've been at IBO for almost 3 years now.
Great. So just to talk through the agenda, we'll just kind of summarize the federal changes to most recently the bill that was passed Congress last year. We'll give some context too to talk about how many people are affected and then try to narrow that down to your community district. Then we'll talk about changes to health insurance, food, so most of the staff benefits, also talk about some changes in eligibility. Then Cass will talk about her report and talk about what it is. The city has expanded it. It is a pilot program and it's not currently available in your district, but we'll talk about kind of the demand for this program in your district. And then we'll answer any follow-up questions too. So as you're all probably aware, the federal government is deploying a lot of concurrent actions, these being staffing reductions at the beginning of Trump's term and throughout, very rapid policy changes, and then legislative actions like the passing of the One Big Beautiful Bill Act that kind of made a lot of changes to eligibility requirements for public federal programs. And we'll just talk through in the next couple slides how those are going to really trickle down and affect low-income communities around the country. Sorry, a little bit of a depressing topic too. So just to give you some context, for New York City, around 1.5 million New York City households live at or below 250% of the federal poverty line. That measure is around $32,000 for a family of 4. And the reason we're looking at 200 to 250% as a cutoff Because this is mostly, what the federal government uses, to determine eligibility for many of their social safety net programs such as SNAP. In 2023, given some context about your community board, around 25% of the population in your district was measured to be living in poverty compared to a citywide average of 18%. So this is just something I pulled from your district needs statement as well as the NYU Furman website, but pretty significant amount of this district is also living in poverty, which you're probably aware of as well. The median household income in 2023 was around $56,000 in this district, which is around 29% less than the citywide median household income of around $79,000. And there's also a lot of discrepancies, so there's a lot of very, very high income households in this district as well as very low income households, so a lot of discrepancies within the district as well. So turning to healthcare, the healthcare costs in New York City are obviously very high, and so in 2024, the average family spent around $5,500 on healthcare. This was for people with health insurance, so still with health insurance, you're still spending a lot of out-of-pocket costs, and then these costs are also rapidly increasing, so you're seeing around a 13% increase in these out-of-pocket costs over the last 2 years. The things that we kind of wanted to point out about the federal changes is that there are also changes that were made or in the last congressional bill. Primarily the expiration of the Affordable Care Act, enhanced premium tax credits, and so that will probably also lead to costs being driven up for families, especially ones that are uninsured. In terms of your community district, this again is pulled from your community needs statement. But around 4% of residents in community district 3 are uninsured, and that is a reported measure, but there are probably families that are unreported too that are also uninsured. Turning to food now, a large part of the congressional changes were changes to SNAP eligibility or food stamp eligibility. SNAP is a federal program. It's authorized through an annual congressional appropriations process, but the people that are actually administering SNAP is usually the state that you live in or the city. And so while the federal government is giving money to families through this program, all the benefits are administered through the state and city themselves. And so just to give a little statistics about SNAP recipients, around 36% of the SNAP recipients are children, and around 20% of adults of SNAP recipients are adults over 60 years old. So really benefiting children as well as seniors. Turning to your district, in 2024, food insecurity rate really varied in different neighborhoods of Community Board 3. So it was around 23% in the Lower East Side, 17% in the Chinatown and Two Bridges area, and around 16% in the East Village. So a lot of variations in food demand, but pretty high statistics too. In terms of food pantries, this is something that Cass has done some reporting on. But food pantries often fill the gap for people that are not qualified for SNAP, but they've never been really able to meet the demand for food in this area or across New York City. But food pantries are also something that experience cuts in this bill of around $1 billion, and so there might be more reliance to private donations or turning to the private sector to kind of replace this in federal funding. So in terms of the more granular changes that were made in the bill to SNAP, the first one was that the federal government is starting to shift a lot more of the costs onto New York State or any state that is administering SNAP. And so they are using this thing called the error rate, which is basically if the state ever gives people too much money for based on what they're eligible for, to kind of penalize the state, and make them pay for a larger share of staff benefits. Another thing that they did, in this last bill, is that they're limiting future increases of benefits. They're also eliminating staff education programs. This is something that, as you all know, applying for staff is a very tedious process. There's a lot of paperwork involved. And so, the elimination of the staff education program, is really detrimental to people that are applying, for the program, but might have like some questions about eligibility or paperwork. They also are requiring increased work requirements, which I think was widely reported on. And then also excluding, even people that are, lawfully present as immigrants, from being eligible for the program. So a lot of really chilling effects. But another thing, kind of nuance I wanted to point out too, that might affect people in, this district, is that there's also another federal program called the Low Income Home Energy Assistance Program that helps people pay for their energy bills. If you are enrolled in LIHEAP, you automatically are qualified for SNAP as well. But because of the federal changes, they can separate the relationship between the two. And so you now need to apply for both individually. And there's also more paperwork requirements that are detailed on the slide, that are going to be required for families to, apply for these programs. So with that being said, I'm gonna turn over to Cass to talk about BHERD. And then you can definitely follow up with any questions for Skynet as well.
Okay, I'm going to assume some people might be familiar with BHERD and others might not be, so I'll run through an explanation so that we all are on the same page. So BHERD essentially is a non-police response program. If a person is in mental health crisis and you call 911, traditionally the response that they receive are a combination of police and ambulance. With BHERD, if you call 911 and you sort of answer these triage questions just right and you qualify, you'll be sent a team of 3 people, and those 3 people are going to be a social worker and EMT. So BHERD has been in existence as a pilot program in the city since June of 2021. It is still a pilot program. It is not run 24/7, it's not run citywide. And it's jointly operated by health and hospitals, so the public hospital system and the fire department. Health and hospital is the entity supplying social workers, and then the fire department is then supplying the EMTs. So that's sort of the basic running of the program. So in our series of reports, we did a longer report and a companion piece about BHERD. We have really rich data from the fire department that spanned like 4 years. So from the beginning of the program in June 2021 through the end of March 2025. And what we did here is we broke down the call volume from like mental health calls to 911 by time of day. Because the program runs from 9 a.m. to 1 a.m., so 16 hours a day. And we wanted to analyze and see if we're capturing the majority of calls in the times when BHERD is operational. So what we see is that for the areas of the city inside the pilot area and outside the pilot area, they only make 17% of mental health calls outside of those hours of operation. So they don't capture everything, but they are hitting the times when call volume is at its peak. So the areas of the city that are covered are on this map. Like I said, it's not citywide, and it's started in 3 precincts in East Harlem. And then it moves up to the Bronx, down through Northwest Queens, and through Central Brooklyn. It rolls out by police precincts, and so it covers 31 of 78 precincts in the city. So about 40% of the city's geography and population. And what we see in the rollout is that they tend to expand it in such a way that it's a contiguous geography being covered. So like the pilot area remains like as one touching geography, if that makes sense. So something to consider in terms of advocacy for further rollout, is they tend to want to keep it a connected area. We also analyzed response times, so this is looking at citywide response times for all mental health calls. At all times of day. From the beginning of the pilot, like I said, in June 2021 through the end of the period for which we had data. You'll notice, the bars represent call volumes. And this is broken out into fiscal quarters, so every 3 months of the fiscal year is represented. The first bar is really short because that really only represents 1 month. Because the program started at the end of the fiscal year. But we see call volume sort of decline over time. Really what the takeaway here is that response times are slowing over time. Both for the average and the median, and we really just focus on the median in the report and for the rest of this presentation. But at the beginning of the period, the median response time was about 10 minutes, and then at the end, it's about 16 minutes. So it has slowed down a bit over time. This is a lot of numbers, and you don't really need to read all of them. Essentially what's happening here is that, as the pilot area grows, the call volume in the pilot area also increases because it's a bigger geography, they're just receiving more calls in that area. What also is happening is that fewer calls are being, assigned and heard to over time. And that could be attributable to the staffing issues that they're facing. So when the program started in 2021, it started in 3 precincts with 2 teams per 8-hour shift. The program runs from 9 AM to 5 and then 5 to 1 is the second shift. And so each shift, there were 2 teams available to respond to the calls in those 3 precincts. It has expanded, like I said, to 31 precincts. There are now 9 teams serving that entire area in any given 8-hour period. Which is not a lot of teams, and it's not been scaled proportionate to the way we started. So it does make sense that fewer teams are being assigned to calls because there's just fewer teams to go around. Next slide. So when we narrow the focus to the pilot area, we split this into calls receiving Be Heard response and calls not receiving a Be Heard response. And we do see that those calls that receive a Be Heard response, I have to get a little closer, my eyes are bad. This is median response times for calls, both receiving a Be Heard response and not receiving a Be Heard response. The median response times for those not receiving a Be Heard response are a little better. And we see that it flips early on. The program was expanding to more precincts, but they weren't adding as many teams per shift as you might want them to. And so we see that time sort of switch up in the beginning there and stay consistent. So for the not Be Heard response times, we're looking at about 19 minutes. And for Be Heard response times, we're looking at about 22 minutes. And then when we look at time spent on scene, Be Heard teams are actually spending a longer time on scene than other teams might be. And we would think that that's because they're spending a longer time to try to really figure out what's going on scene and resolve the case once they make contact, which is great. However, like I said, there are not as many teams to go around, so this is not happening to as many calls as you would like to see, perhaps. Next slide. The companion piece that I mentioned looked at call rates by precinct, so this is what you might be particularly interested in. So we looked at each precinct, we pulled out what each precinct's population is. And we figured out this is the first quarter of 2025, so fiscal year 2025, this data is representative of that first quarter. So we have the call count in that quarter. And what we did is we standardized it to a call rate per 10,000 residents, so that we could more evenly compare across precincts what's going on in terms of demand, if we're using the number of calls as a measure of demand. We see that the 5th precinct is actually second here, and it's pretty consistently in the top 10 year over year, but it raises to the second spot in the last year of data that we have. That highlighted purple rows are places where We Heard is operational. So what we see is that, if we're strictly looking at call volume as a measure of demand, we're not really hitting all of the geographies that have a high demand for the program. Because about half of the precincts here don't have Be Heard, and this is the top 10 by call rate. The 7th and 9th precincts are also in this district. And I did check before we came here, and they rank 30th and 31st in this time period, so there's a range. So the 5th being highest demand, and I think this is the last slide. Great, so any questions?
Any questions? Arnett, and Johnny, and then Tahisha.
I think under the presentation, I noticed that you didn't say anything about, like vouchers and what's happening in housing, so is that also being taken away from
The section in paid vouchers.
Yes.
So that we can definitely look into, it wasn't in the report, we also did a separate report though that was just on housing. And all the changes to the federal government that affected housing specifically, so I'm guessing. That's the report that section 8 would have been in, but I can send it to you or.
So generally, Congress is supporting section 8 and not section 9, which is why you see, all these, captain types of changes happening in NYCHA.
Okay, because I have a friend who is applying to Section 8 voucher, and he's now being told that he has to apply to NYCHA because the
Yeah.
voucher program is ending.
Yeah, so it's Congress that is supporting more section 8 and not section 9. Section 9 is what NYCHA was, or it is the privatized NYCHA is section 8.
And then my other question was, I feel like, the poverty rates for the Lower East Side, they seemed a little low. You said that 23.4, and that includes the seniors and everybody in this.
Yeah, so this was 2023 data, it's from the NYU Furman Center site, and it was in your district statement, which is why I pulled it out. But I'm not sure exactly, like, this is from census data, so it should be pretty accurate. But it could have maybe changed in the last 2 years too, if you.
And it's updated, I forget the way they update it between census counts. There's a way they update it, they extrapolate information, update it between, so that's our information that they took it from.
It's due to the averaging of the high and the low, right?
For-
Well, why it's like, she says 23 seems low, but it's also due to we have.
And
Well,
when
we
you-
have disparity.
It's from the census,
But we have high income people and we have low income
Oh.
people. So then when you average everything out, it kind of falls in the middle.
I think our average.
I think it's just the poverty
Yeah.
rate though, so I don't think.
Oh,
it's
the poverty
just
rate.
an average, yeah.
But that's why we Our median income here is 55,000.
I'm showing them.
Well, let me know if you do find it different.
No, I was just giving that as an example of how poor people are even when you average things out, it's still very poor.
Tahisha,
So thank you for the presentation. I have two questions when it comes to your Be Heard presentation.
Oh, wait, sorry, do you want to say one more thing about the poverty rate? It's also possible because the federal poverty rate is so low, it's like $32,000. So if you're making 33, then you're not counted in that measure, and so maybe that's why.
Yeah.
You're seeing only 23%, but like there might be people in like the $40,000 range. I would feel like in New York City, if you're making $40,000 for a family, for that's poverty, but it's not captured by that measure, you know, so that would be, yeah. Sorry to cut you off.
My two questions is, I noticed that you said that in the teams, there's social workers and then the two EMTs. Is there a reason why there's not mental health counselors in that part of the program?
I don't know that I can speak to that so much. What I do know and have heard from like hearings and such is that there are a number of different formats that it could have taken, like it could have had a nurse and EMT, or like a nurse and EMT and social worker, and they, for whatever reason, in their plan, they chose to go with social worker and EMT. I know a lot of people also advocate for like peers to be joined into those teams, and I think with the new administration, they might be looking at modifying the format. So for now, that's the structure, but it might change.
The only reason why I say that is most social workers are not clinically trained. And if they're out doing, the work they're doing when it comes to people who have behavioral problems, mental health counselors, that's our wheelhouse. So I understand like there are clinical licensed social workers,
I do
Yeah, I know
think
there's
that
a-
it's the licensed ones, the licensed clinical.
Yeah,
social workers, so
but there's also like, there's a shortage of it, it's more like mental health counselors, so I'm wondering, are you guys just pigeonholing just the social workers and not also getting the mental health counselors that are also in the area as well?
I do think for now that that's the structure that they are looking to stick with, but they might change going forward. And I agree that there has been a widely reported shortage of social workers. But the hospital system has really wanted to make clear that they made efforts to increase their staffing in that regard. And they said system-wide, not for Beaver, but across the system last year, they hired like 400 social workers. So they're really making an effort to increase staffing of social workers.
And then my other question is, do you guys know what the behavioral issues that they're having? Is it more of psychotic episodes, manic episodes, not depressive? Is it drug related substance use, or is it a combination of it? That's why they're having these different conversations, like calls, or you guys don't categorize. The reason why I'm asking that is like, there's different ways that the mental health episodes happen and how they present. And depending on what levels they are, that's why they might take longer, depending on the session of who they're coming to see.
Totally. So in our data, we don't have outcomes and we don't have categorizations of like what was happening on the call and how they might have classified that. What I will say is that so the calls go to 911 and are routed to FDNY, and on FDNY's EMS side, all calls have 8 different categories that they can fall into, and they call them segments. And segment 1 is like your highest priority, and segment 8 is your lowest priority. All mental health calls, regardless of the various things that you were just saying, they all are segment 7. So they're all considered sort of low priority call.
And so all the calls or
All mental health calls are in that segment. They're all classed together,
so you
so,
guys have sections of like 1, 2, 7.
so FDNY has segments 1 through 8. And any mental health call that comes in is segment 7.
So no one knows what they're going into. It's so like you having a psychotic episode, but they're deemed as combined with all the reason why I'm saying is like, you have people that are trained, but you also, if they don't know what they're going into.
It's not them, they're just.
I'm asking, I asked the question, like, I need to ask the question, and if you let me finish, you guys will understand where I'm coming from, because this is what I do for a living. So the reason why I'm asking that is, if you have someone that's, you blanket it as a level 7, they're going into a place that the person is calling because someone is in distress, but they don't know what kind of distress. How is that also making sure the people that's going there are being protected in the place that they're going? That's what I mean.
Understood. So the teams that respond will have more information than I do. I'm just looking at the data that the fire department sent to me. However, all the mental health calls are technically classified as the same level, but they will have more information about what the specific situation is that they're responding to. Also, BHER teams are not sent to the scene if there's like a weapon on scene. So those calls will still get a traditional police and ambulance response. So based on the triage, they decide that it's eligible and appropriate for a BHER team to respond. And then the team shows up, and if they need further assistance, they can call in for like a traditional team to assist them.
Yes, I think, just to be, okay, so just to be clear, or just to remember, because I know.
I know how to ask the question, I feel like if
Wait, let
this
me-
is, no, before you try to police what I'm doing, I want you guys to understand, this is what I do for a living. And there's a reason why I ask these questions, because it's for me to open up the scope of what I'm trying to find out. If they don't have an answer to what that I need, I know that I can get some information from them. I know how to ask the question.
Right, okay, I know you do, but I'm saying that what, all the questions you're asking is actually maybe something that we can advocate for if they ever, because they have to be heard.
Oh, I
They have to be-
I understand that, but I still should be able to ask a question, and that's why it can go even further.
Okay, so we'll note it down and then we'll see how far we can take it. Does that sound
No, I
good?
think that's a great point though, because if FDNY is just lumping everything into segment 7 and they're not distinguishing, like that's something that maybe we could look into too and see. If their data that is distinguished beyond just segment 7, we can definitely get back to you on that. But what you're raising is a great point about the program too, and it's probably why they have such attrition with their staff, because it's such a tough job and sometimes you don't know what you're walking into,
Yeah.
and so they do have a lot of staffing challenges as a result. But like you're saying, being more granular with the description of what they're walking into could be helpful for.
Yeah, this is really, it's really amazing work that you're doing, but I think if you're not the people that actually is doing the triage and then also understanding the different kind of mental stuff that people are going through in their mind and in their family, it's just getting clarity, like just to open up the scope a little bit more. I know it's a report, but it's just like, that's how my mind works of like getting the information out.
That's a great point, and we'll definitely look into the FDNY segment 7 and see if there is anything that
Yeah.
they do report on, because that's a really important question too.
Thank you.
Oh, and I have a question on the next.
No, I just wanted to make some comments about that, sort of based on that. So one of the issues of us, we've been actually trying to get the pilot down here since, and our budget priorities, unsuccessfully, so we've also been reading a lot of the research. And it seems to me that one of the big problems is that the operators that take the calls, they're the ones that decide whether it goes to FDNY for a mental health response or whether it goes to 911. And it's, from what I'm understanding, is that they send way too many calls to 911 instead of calls that really should be going to FDNY. I don't know if you have any information on that.
What I would say there is that, well, first, we don't have the triage questions that they're asking, but based on those questions, they're routing things either to a traditional response or to the fire department for BHER. The other thing I'll say is that they're limited by the number of teams that BHER has. So the program spans 4 boroughs with 9 teams to serve like a huge geography. So part of the reason that you might be eligible for BHER but still receive a traditional response, there just might not be a team available to respond to your call in the moment. They might be engaged in another call.
Does it say that in the research at all? Because I don't remember reading that. I know the problem exists, but I don't remember if there were any backup information on why this happened.
I think in our report, we said that.
It does have that.
Yes.
Okay. And I'm wondering if more training for the 911 operators might make a difference. Because they're going through a transition of like, oh, now all of a sudden I have to decide if these calls should go over here. And so, you know, that is something new for them. And I'm wondering if the issue of training for those operators to make the decisions is something that is being considered or needed. I know, I expect there'll be a lot of changes, new administration, I expect there'll be a lot of changes in the program.
I mean, I personally, not speaking on behalf of IBO, I personally would always advocate for more training. But to see what the new administration is doing in terms of like training and retraining existing people and bringing on new people, where it's unclear yet.
More things to find out.
Okay, Arnett.
Thank you. Hi, my it's twofold. One, being that it's still labeled, pilot in your research, does it seem like it's moving towards something that will be permanent? Also, in your research, was there, information about the funding? Because I'm thinking of when we, with, Susan's question, the use of AI. I don't know if that's something that they would think of, or are they already using AI to determine, which calls should go where? And if so, how much does that cost? Does it seem likely that, the pilot would exceed the cost of what they're looking at now with their current budget?
So we did touch on funding a little bit in the report. I think that the numbers we put out are for the first full year of operation, funding was 21 million. 21, 26, one of those, and current funding is at 35 per year. We also mentioned that as of March of last year, there were 38 social workers working for the program, so there are 9 teams per shift, but there are more people on payroll than that, because people have time off, whatever. So 38 social workers and then 57 EMTs, I think. So part of that 35 million is going to staffing costs, and then the other part of that is going to everything else, so getting the vehicles and operating that and what happens. We don't get more granular than that, and I think the city is still establishing its sort of protocols as it relates to AI. And so I don't know that they will choose to involve that in call taking going forward, but the city is looking into like what are the parameters of like using AI at a city level.
Susan?
Yeah, one more since you mentioned Chinatown. How many of the respondees speak language of the person
That's a
making the
great
call?
question. That's a great question. We don't have that data, but that's an excellent question that I'm happy to follow up on.
Okay, any other questions? Are there any questions that have don't? There are no questions there. Are there any more questions or comments from us here in the room? Okay. Is there anything else? This is not so much for you, but you know, there was a lot of like, I heard like recommendations and things that should be done. And this eHeard program will now be under a different
Yeah, I mean,
office or
so all this research is the way it was done before.
Mhm.
And it's now, this is now a priority for the new mayor, that is gonna be built on. So I'm expecting a tremendous amount of changes. Hopefully, the information that you're reporting on will inform what they're going, what they will be changing.
Yeah, they did announce at the end of the Adams administration that they're going to fully run it under FDNY, but
Under HH.
yeah, under HH, but I'm not sure.
The new administration has kind of walked that plan back and has said that it will continue to be jointly operated by both the fire department and the hospital system. The other thing I'll say about funding is when the current mayor was campaigning, he did an interview where he did talk about the Department of Community Safety and his plans for that. Didn't mention BHERD explicitly as sort of one of the programs that he wants to roll into that department. And a lot of people advocate for like citywide expansion and they want it to be 24/7. And so he did mention briefly, I don't know if he brought it up ever again, that we need to increase funding for the program, and the number he threw out was like $130 million. So I would say it's something that he's at least thought of. But that's the number that he's thrown.
That was before he got in, but how much?
Correct.
Okay.
But he has started the division or whatever it
He
is.
has created
It's, I
an
think it's a
office
one
within.
person, but I mean, it's clearly a priority for him. And yeah, it's like, and he's finding out he doesn't have any money, we don't have any money, but the office is open. You know, at least he's taking steps.
The initial structure is there, we'll see what it.
Well, at least your district is in the top.
Pardon?
In terms of demand though, you're.
One of your precincts is in the top 10.
So do you think that, but, so you mentioned that they're rolling it out contiguously,
It does appear that way, yes.
which is to me an equity problem, because they're, if you're looking at it geographically, not where the need is, I don't understand how that makes sense.
We think it's like a mix of things, because when they initially started in Harlem, the rationale given was that it was because of the volume of mental health calls. So I do think it's a mix of those elements that plays into it.
Yeah, but so we're now looking at Chinatown, which is nowhere near
Right.
anything geographically, but in great need, obviously, great need. A
Right,
very
well-
low income community.
It's not in your area, but the precinct that year over year is the top one in terms of volume of calls. Is the 14th, which is like Midtown South. So it's that like Times Square, Madison Square Garden area. And that's also not served by Meeker, so.
But those, I think it's a different population.
For sure.
It's not residents.
For sure.
It's people who probably new to the city and homeless who are, you know, there for, because there's a place where they can stay, whether it be Penn Station or whatever.
Right, so things like that, I think, are probably part of the reason why you would, on paper, see a high call volume, but not have be heard necessarily in the area.
So
I
that
think
that I can understand, but not Chinatown.
Well, they need to start something new down here.
We've been trying.
Well, the fun fact about Midtown South is that the highest 311 calls is for Margaritaville in Times Square for noise complaints. So I just thought that was funny.
I can identify.
Good enough. Okay, so thank you very much.
Thank you for having us.
Thank you. So we're gonna move on to our next agenda item.
Thank
which
you.
is a lot of cabins that you see before, so you're welcome to stay, but looks like you want to go.
Yeah.
But actually, it is. Actually, the next agenda item will be a discussion of planning for term limits.
Yeah. I'll connect to for the FDNY question as well.
Okay.
Yeah, and we already.
Thank you.
Thank you. I got this. Okay, so,
I wanted to see if people raise their hand if they have any questions or.
Oh, yeah.
Oh, you can
I
see
can
that.
see them here, yeah.
Okay.
what it is in here, like, so. I'm gonna. Yeah, I saw your email, about this, you said something was duplicative or something about, term limits. There was like two sentences that were.
Oh, I just, yeah, the two I didn't the last two you had on the list you sent to me, I didn't know the difference. There are two survey questions and,
Oh, the survey questions or?
yeah,
something else?
well, I didn't understand the difference between. Okay, so if you move, yeah, go up a little bit. Up, no, I'm sorry, you went up too far. Yeah, so they send emails with questions. How is that different from send a survey? I didn't understand the difference.
Oh,
between
it's
those
a
two.
little bit different, okay, it's slightly different,
Okay,
okay, so that's more like, okay, okay, so so this is for planning for term limits. So at the last meeting, Susan asked me to, we had discussed this before at, in a previous discussion about planning for term limits, that we, it was within the time, when we're discussing our timeline, that we do a survey, to inform ourselves about district needs. It's like a 5-question survey. But I thought Susan asked me to give a little bit more contrast to it. so that's what this is. So, so as it says on the screen, so I made some notes and everyone can look at it and see, if you understand or agree or disagree. So this is the survey that we, give to community organizations. It's about 5 questions. The 5 questions are on the bottom. It's, what's the most need, which services require more funding, what's been highly successful, that would need more funding, what would you like CB3 to advocate for? And then we have a 5th question that's more customized for that particular year. Last year it was about immigration, so it was about have you experienced increased need for specific services due to new refugees, migrants, or asylum seekers? Because that was the second year that, we got the influx of new immigrants. So, so we do a lot of work, just stepping back a little bit, we do a lot of work to inform our district needs. In some years, we host those panel discussions. We often invite speakers to come to present to the committee. We send emails. So that's when we, the sending email thing is when we, you'd say to us, we each get a little section to research, if you recall. And some of us research by looking it up somewhere, and some of us research by asking somebody. So the question about that specific section. So that's what that is. It's not the survey.
Send emails to.
Yeah, I do it all the time. Yeah, it's, you can call them or you can send an email. And then often we'll get a response, a written response. And often it is cited as, email correspondence from XYZ.
Got it.
So that's,
So
so that's what that is.
So it's more like the research.
Yeah, it's not a research thing. It's more like, you need to, update the district needs. And it's like, update something about the number of schools that are, so like someone will send an email to Carrie and she'll like that. So it's not the full 5-question survey. So, and then there's a full 5-question survey. So what the survey, it is certain things and it's not certain things. So this is not a research report. If we want the research report, we have done them. Well, we have not done them. We've hired a consultant to do that. And they, do the research and they would produce a product. For example, there was a catalog of mental health providers in this district. And it is on the website. And there are other research reports too that are all on the website. So this is just for community organizations to answer the 5 questions. It is, we decided no more than 5 questions. And then just a little note about how people respond. Some people are like all surveys, some are very quick, like all respondents. Some are very quick to respond, some take a long time, some would rather just come to the meeting and talk to us. Yeah, and then, so that's about it for the survey. I didn't put this in the notes, but we don't do it systematically. Often we just send it out to those maybe who we hadn't talked to in a while. So we can, if we like, we can maybe, as a matter of practice, just send it out to everyone anyway. Or not, I don't have a particular.
We've never made a list
uh,
of our CBOs,
you know,
but we know a lot of them because they are us. But I think it might be actually a really good idea to make a list, start with all the ones we know, but there's a lot, because I think we tend to work with some of the same people over and over, and therefore sort of have a bias towards sending stuff to them. And, maybe a list would help. And it's easy if you're sending out a survey. It's just almost as easy to send it out to 30 people
Yeah,
as 10.
Yeah, so I recalled in one of our meetings, some committee members got really enthusiastic and said they could help. But, I think that, we could start something, but, in the end, we all know everyone, and in the office, There was no, I really know everyone because you know, so it has to be somehow centralized to the office to, or filled in with the others that are not there. A good start.
Right now, I'm not giving the office any.
Okay, well, I'm not saying right now, but in the end, it should, be connected.
Well, it could be connected, but that doesn't mean that you have a committee that is very involved with all these groups, and those groups can't put up lists, even if it's off the top of their head. Just create lists, and then we can sort them alphabetically, so to get rid of the duplicates. Because there are also smaller and newer organizations that we should be aware of, that I'm not. And, I think some of you that work for nonprofits are more aware.
Okay, it's just a list. Pardon? I think the other person was talking like a full-fledged survey of each group.
No, I was just talking about making a list of the organizations, name of the organization and the contact email.
That's. And also sometimes we should not forget the organizations that are on our committee or, and sometimes it's not even that committee member who answers the survey. It's someone else in their organization. I mean, their organization is large enough to have someone else to do it, so. we
They
should
can make sure their organization's on the list.
Yeah. That has happened. So any, comments or questions about this?
On the other side. Here,
Oh, Arnett, yeah.
Question, when we, speaking of listing the CBOs, are we listing non-for-profit or well-known CBOs? Cause there, I think since 2020, there's been quite a few smaller non-for-profits sort of feeding into larger CBOs. Should we think about adding those to the questionnaire?
what's an example?
Yeah.
I just had my, client social wellness retreat ran by Canal. I don't know if someone like, as she's growing, non-for-profit, someone like that, should we not, Canal, I can't.
Oh, Kenyelle, yeah. Yeah, she just told me I have to come.
Yeah, so I don't know if you're like referring to persons like that are actually trying to feed into.
I don't know, but she has like a grant to work for a certain amount of time. I don't know if
Okay,
that's considered like a permanent thing.
okay, cool. Alright,
I mean, she's actually working more with Vision Urbana, I think, right?
well, she's using their space.
Their space, yeah. Yeah, I don't think that's permanent. I think that's like a grant that she's doing something while she has this grant.
Okay, I just wanted to
You know.
narrow down what I should be looking for as.
Yeah, I think, the ones with a staff
Okay,
that offer consistent services.
Yeah, so the staff doesn't, it doesn't have to be as large as a settlement house. After all, I mean, not everybody is a settlement house and there are only so many of them. It can be small organizations, asbestos, their staff. There's a lot of these, when people have projects, like their personal projects, but, so what we're looking, this is about district needs, we're not referring clients there, we're not, so it would be people who just have a lot of information from on the ground. So I do know of people who have their like personal wellness company. And they see people, but it might not be the most helpful. If you know what I mean. I'm not saying they don't do good work, but just for us, for our purposes, we just need something else. Any other questions here? Should I somehow put some of this separately, make it a document?
Yes.
Maybe not all of it. Or is it all?
There you
Okay.
I want to capture everything and put it
Okay,
on
I
the
just,
website.
because I was gonna add some other stuff that was more commentary, then I was like, no,
You could, I mean.
no,
you
it
can add
wasn't,
that.
it wasn't, I'm not like.
It's electricity, it's like free, you can make it as long as you want.
No, well, no, but people say it, so that's what I'm saying. That's not what. It's like. Okay. Okay, so,
Happens easy.
Okay, then that's, we actually have a bunch of reports from CABs and CECs. Well, shall we start with? Shall we start with 30th Street?
Sure, you want me to give a report on,
Yes.
on that? So as probably everyone in the world knows by now, the Bellevue Intake Center is, in a building that is physically dangerous and has to move. I think it's clear that these problems have been building up and not being addressed for quite a while, and now it has to be addressed as an emergency. So at Bellevue, there is a shelter and an intake center. All the shelter beds, people in the shelter beds have been relocated around the city. That part is not moving down here. We have, to step back a little, currently, or until last month, we had at 8 East Third Street, we had a single men's shelter, I think was up to 200 beds. There is also in the facility a 60-bed inpatient rehab program that is run by the state. Project Renewal is the provider, but it's a state program. And there's also a 60-person outpatient rehab program. Again, the provider is Project Renewal. Additionally, there's a federally qualified medical center at the facility. And the medical center is primary health plus psychiatric medical treatment. It is a sliding scale, so it's open to the public as well as the people in the facility, and it ranges from free to low cost for people who are eligible. Kenton Hall around the corner at 333 Bowery has gone through several different iterations of types of shelter, and recently it has been a men's behavioral health shelter. So in order to bring the intake center here, the shelter beds at Kenton Hall and at East Third Street have all been relocated to other Project Renewal shelters. The two state programs, the in-bed rehab and the outpatient rehab, as well as the medical center, are all staying here. They will not be changed. There will be two intake centers moved here. A single man intake center will be at 83rd, and an adult family intake center will be at Kenton Hall 333 Bowery. I think they expect the number of visits per day to definitely be under 100 based on current intake at Bellevue. So there may actually be less actual people at the facilities than currently, but they're people who are clearly unstable. They're looking for beds, so they're not stable. There will be, I think, 120 beds at the intake center at 8 East Third, which will be assessment beds. So when people come to the intake center, they may go through an intake process and be transported to a shelter. If they come in the middle of the night, they will be given a bed for the remainder of the night and then assessed and taken to a shelter. But then there are also people that need up to 21 days assessment. So they will be in the beds that are being provided there. They can stay up through 2 to 3 weeks for assessment to be placed in the proper shelter. And that's kind of it on services, what's happening, what's being relocated, what's happening. There is a community advisory board being formed. The Department of Social Services expect the appointees to be by the community board and the elected officials. I've been speaking to the council member about this. And I think that the community board has always had members, community board members as CAB members. So currently we've had 2 members at that site, 2 CAB members, that will go up to 3. And then there will be appointees from the other offices. We also looked at sort of at-large appointees. That means, you know, they would definitely have somebody. One would be Cooper Square Mutual, which would have a management and a resident appointee. The hotel, which is right between, and then at least 2 other local businesses. Particularly, you know, some of the businesses expressed some serious problems at the meeting the other night. There would also, elected official reps would be attendees, but they would be advisory, and as well as Coalition for the Homeless, who simply has a lot of information.
Well, and, what of project renewal?
Well, Project Renewal will still be the provider for the inpatient, outpatient. And I believe they're the ones that hire for the medical clinic. I'm not positive about that. But I believe that that's true. But so this hasn't come up yet. I have talked to Project Renewal about this, but you know, my suggestion is that the Project Renewal facilities should absolutely be part of the CAB as well as the DSS intake centers.
So, the clients of project renewal that are there,
They've all been relocated.
oh, okay. Any other questions? Okay. Actually.
Yeah.
Has there been any calls from the community based on this changing from Bellevue to Project Renewal? Has anyone in the neighborhood objected or happy about it? What does it look like?
Very, very much so. You didn't go to the meeting last
No,
few
I
nights
couldn't
ago.
make it.
May was at the meeting. I think, you know, I feel it's kind of strange because we've had CAB meetings. I've been going to every CAB meeting there for over 20 years. May has been going the last couple of years. And I actually have done a tremendous amount of outreach to try and get people to come, even handing out flyers to businesses, because we always had those meetings as just open to everyone. That's how it was in the past. And if we got like 5 people from the community at a meeting, it was a lot. And people, you know, particularly the businesses, had some complaints about theft. People had concerns about loitering, you know, residents that live here. There have been some incidents, but I'm gonna say few and far between as far as real incidents. But we didn't have, you know, it was basically people on 3rd Street and 4th Street. People did not come to the precinct meetings and complain. When we had the build and block meetings, there were not complaints about that facility. And the security, the head of security for Project Renewal would always come to address things. And then all of a sudden, even though there's actually going to be less people, it'll be different. It might be a little easier, it might be a little more difficult. We don't know. But there will actually be less people there. I mean, we've had a shelter of single men with behavioral health problems, and it has not been a problem. But I think people are very concerned about the unknown. And also Bellevue, where it was located, did have a number of concerns, but that was a shelter and an intake center. So I think it was like impossible to say where the issues were. I also, you know, the new DSS commissioner was at the meeting, and I think she appears to be incredibly sensitive to community concerns.
Thank you.
Okay. No questions? Okay, well, I do have a report about, D1 plus, they have a monthly meeting. So D1 plus is the, sort of the, network of schools in District 1. The plus is in District 2, and it was the one that was founded to, kind of, support the schools and all the immigrants that, they're getting in the schools. So it was a small meeting, it was actually the day before a school holiday, but, Carrie was there and she did report about, something she talked about before. So, in the past, she had talked at the meeting and also to us about how she wanted to start this like center at, PS 20. She has since then changed her mind. So she decided, we'd like a center, to welcome new immigrants and, have all these resources and, but she has since changed her mind and decided that it should be more, localized in each school rather than just have it at one school at PS 20, because there's a lot of different schools and all the schools have some kind of space that they could use and it would be, more convenient to the students there. So that's, and then, and it wouldn't cost them that much, because you use an existing room and, and they'd have like all together. So that's all, and then they said that the UFT has gotten involved to train the teachers more about, so that they can work with the students. So that's it for that. No, anything else? I'm the.
What's the meeting open?
No, I'm trying to see if there's any more Catholics that you see. I'm trying to see if there's any more Catholics that you see, but no one is here for it. And no one is here from for the other tabs. So
Yeah, Eric's not here.
Aaron's not here.
Eric's not.
There was a Presbyterian meeting, finally, it was an April, so every time it's like. But it was something we put on next month. And about this one. Okay, so I guess we can, also, I just want to remind everyone, the next meeting will be on May 6th. It's a Wednesday, not May 7th. Can you all make it? Yeah,
Where is it gonna be?
I don't know.
We don't know.
Okay, yeah. But that's the date, this one. Is it okay with you, Keisha? Okay. Okay, please.
Mhm.
May 6th, okay.
Okay.
All right, so we will now have the roll call.
Okay. Amy,
Yes.
Eric Bennett, Eric Diaz, absent, Keisha Beals, and Stefana absent, and absent, Robin Alvarez absent, Rob absent, Brian Rivera.
Yes.
Scott. And Carmen Perez absent.
Okay, the meeting is adjourned. What was that? Hello?